So y'all, most of you all know me. If I think everybody was here last night. I am Dr. LaShonda. I am a licensed professional counselor. I am the founder of Heal, Holistically Evolve, Align, and Live. And I am also the CEO of Dreams and Visions, which is a group practice that provides mental health therapy. And I wanted to talk about gut health, right? I knew when I started, it was a documentary that really triggered me like, oh, wait, we need to talk about this. And so Dr. Williams and I are going to get into that, but I want to introduce Dr. Williams to you all. She is a medical doctor, and she's going to tell you a little bit about her business and what she does.
Good morning, everyone. You guys look lovely, well rested. So, I'm Dr. Gabrielle Williams. I'm a board certified family medicine physician in Stockbridge, and my practice is called Gateway Direct Health. It's a membership practice to help busy professionals and entrepreneurs get trusted healthcare that they need and when they need it. And with that, it comes experience with the gut health, diabetes, high blood pressure, mental health, all the things. And I think that talking about gut health is important because it's developing research over the last 10, 15, 20 years. And now the medical community is getting on to like understanding gut health because usually we'll hear that from naturopaths or those who are into supplements. But now the medical community is coming, is understanding more. Hey, there are some things that we can explain that's probably not like a definitive medical diagnosis like Crohn's disease or colon cancer, but these are affecting lots of people. So we need to do more research to better understand what is this chronic belly pain that no one can seem to figure out, right? And so
Yeah.
that's why I wanted to come today and talk about gut health.
Oh, that's good. Tell us some of the like services you provide. Can anyone come to you as a medical
Oh,
doctor?
great. Oh, yeah, great question. So let me tell you why I even started because I'm not an entrepreneur like at baseline.
Oh.
I'm a good employee. I follow all the rules.
And
I'm
it's
coming.
and it's very different.
Hello?
Entrepreneurship is a whole nother world. So look, thank you.
Hopefully y'all will talk about entrepreneurship another time. But yeah, so I went to the Medical College of Georgia for med school, and then Emory for training, Grady for training, and I was tired. Okay, and let me tell you why. When in residency, we saw one patient an hour, so we had all that time to spend with patients. After I was done, I was like, oh my goodness, this is not enough time. This is not enough time. That's what I kept saying. Sure, it was due to inefficiency, right? Because I'm just starting off as training. But when we then transition as an attending, as a full blown doctor and seeing my own patients, and we get 20 minutes per patient, you realize you still don't have you like there's even less time, and there's less time to get to know people. There's less time to educate. I feel like I was just prescribing pills and saying bye. And I know that that's the experience of a lot of you is that you feel like your doctor is not listening. You have to talk to different doctors. You can't have just one physician. Unfortunately, you have to tell your story over and over. You spend a lot of time in the waiting room. And then when you do spend time with a doctor, they're doing this. All right, prescribe you something real quick. All right, bye. I'll see you.
A little closer.
Sorry. Yeah. So they're not facing you. They're talking on the looking at the screen on the computer, and I was tired of that. I was tired of patients not getting the care that they wanted. So I started this membership practice, and so they pay a monthly membership fee, and I'm their personal physician. So it's called concierge or direct primary care. But that allows me to educate is a big thing. I have time to talk about gut health, right? And it allows us to rebuild the trust with my members, right? Because right now it's eroded. I know people don't trust us. I get it. I get it now. Before I didn't get it, but I get it now. And what I want to do is to rebuild that so people are not waiting till the last minute to seek care and then it's already too late. And that's like one of our missions. We don't want people to do that. We want to do preventative care and lifestyle care where we talk about lifestyle habits people can do to prevent disease and even treat the diseases that they do have. So diseases or conditions that I can treat is diabetes, high blood pressure, headaches, mental health, head to toe basically, and see adults. And yeah.
I love it.
Yeah.
Thank you for doing what you do
Thank you.
and doing it in a new way. So, if y'all, just to kind of summarize here, so the difference in what she does than and what you would usually see at a doctor's office, a big difference is also this membership, right? Where you're getting unique care just for you. And so I think that's really important. I love that it is more flexible too. Your availability, like, yeah, I don't have to wait, 2 months to see the doctor. I can personally give her a call and get scheduled. Yeah. All right. So thank you for doing that. Now we're gonna hop into this gut health. Right. Let's talk about it now. Have any of you all seen Hack Your Health on Netflix? Anybody watch it? Oh my goodness, you just watched it. Okay. Yeah, so let me tell y'all, go watch it, right? Hack Your Health is a documentary, and I watched it on Netflix. I'm sure it's on other platforms as well. But that is what sparked my interest in this. Like, it led me down a whole look. I don't want to say rabbit hole, but it sent me in a direction like, oh, let me research this some more. I got really excited. I started finding articles and I'm like, oh my goodness, I need somebody to talk about this with me. Now, Hack Your Health, right? It was using different people in different areas and they were all talking about how their diet was impacting them, right? So what really stood out to me was that people were able to take biomes. Am I saying it? Okay, they were able to take because the medical terminology, I don't got it. That's why I said we need a doctor, a medical doctor. Um, so they took the biomes from one person's gut. They were able to put them into another person's gut, and guess what, y'all? Their mental health issues, like the person that it came from, went into the next person. Like they started experiencing similar mental health issues. So there was one person, I don't want to get this wrong because I watched it kind of a while ago, but it was one person where I believe she was getting biomes from her brother and she started experiencing depression because that was something that he was dealing with when his biomes were put into her. And so I'm over here like, what in the world? This is crazy. Let me better understand what's going on because that's proof that what's going on in our gut affects our mental health. For sure. It affects our overall being. So give us a little insight, especially like help me understand even biomes because that's not my lane.
Sure. So, gut health. So, we know the digestive system, right? Esophagus, stomach, and small intestine, colons, and out, right? And it's basically a sensory to our outside world, right? Because it's just basically a hole. And so, when we're eating nutrients, it's outside world going into our gut. And what we're trying to do is extract the nutrients to process them and then get rid of waste, right? Like that's the basis of our digestive system. Now, within our digestive system are trillions of bacteria, viruses, and fungus, right? When we typically hear bacteria, we think of infection, something bad that's going to take over and cause us pain. But these bacteria, viruses, and fungus, most of them are good. They're helping us break down food. They're helping us absorb food, right? Even with lactose, well, you don't have to say if you're lactose intolerant, but you might have heard that people are lactose intolerant. They can't take in milk and cheese because they'll have diarrhea. Part of our bacteria helps us to break those down, right? And so with that being said, we also know in the gut there is a large, extensive nervous system called the enteric nervous system. So there's a whole bunch of nerves, largest, right? Largest amount of nerves. And so that means that we're communicating, right? The nerves communicates with the outside to the brain and the other way around. So we are communicating with the brain through the gut, right? And that way the intestines are telling the gut, hey, we're full. We got too much of this. We got not enough of this. And then the brain will then process and say, all right, these are the things that you need to do to change. Now, with the bacteria, viruses, and fungus that's in there, they also send signals to the brain. So it's not just a one-way street where the brain tells the gut to do something, but again, the gut sends the signals up to the brain, and bacteria is important for that. So with that being said, there's still a lot of research that's necessary, right? But what we see is that the the hormones, the all the things that the bacteria are excreting, what our intestines are doing, it's not only affecting our digestive system, but also our mental health. And so that's where we see, especially in rats, where they have taken the fecal matter or the things that's in the intestine, transfer it to another rat, and see that there were mental health or psychotic issue like differences in those beings. And so that's why we see that in humans too. Is that this like the way that we're so I think like mental health is not just all about internal what things that have happened to you or external what things have happened to you, but internal how we process.
Yes.
So, with that bacteria, with those things, when you're transferring from one to the other, that makes sense that there's an issue with, getting what someone else had. And there's another way like to connect. So, there's a vagal nerve. So it's a large nerve that goes from the brain to the gut, right? And for people who are dealing with very bad depression, very bad seizures, there's called a vagal nerve treatment, where they'll stimulate that vagal nerve, and that helps to treat the depression. That helps to treat the PTSD.
Mm,
So there's like
that's
again
good.
bi-directional. We brain is telling the gut stuff, the gut is telling the brain stuff.
Oh, this is so good. So I'm sitting here like thinking in my head, what if I told you, right? What if, yes, some of your mental health concerns, the anxiety, the depression, if some of that came from maybe trauma or things that happened externally, but what if we just help you to see that some of that comes from what you eat? What you put into your body has that much impact on how you feel. And so I know y'all, the body, because at these retreats, we focus on mind, body, and spirit. And you can even see right now in the room, right? Everybody not in here. We skipped the body part. How many people were at the workout? We always want to skip see, we always want to skip the body part, but we don't realize how much of an impact that has on our overall health. So you're like, oh, let me get my mental health right. I'm going to therapy. I'm let me come to a heal retreat. That's great. But what's going on inside? Based on what you're eating, that could still be triggering the issues that you're having. And I know y'all don't like it because we pull out all the healthy snacks for the heal retreat, right? Y'all are like, where's the good chips? But we do that on purpose. We're really intentional. As y'all can see, there are no sodas in sight. There are no sodas in here, right? So I'm trying to, and I try to do it in a gentle way because I know some of y'all are. If I just completely had all of the healthy stuff, some of y'all probably wouldn't come. So I try to be gentle in like incorporating it, but I need y'all to see how serious this is. If we don't take care of our bodies, there's no way that we're going to see that maximum overall wellness that we desire.
For sure, because the American diet,
Let's talk about it.
processed foods, high sugar, lack of fiber, all the things. Hello?
Stuff that's banned in other countries. Banned. Oh, not even allowed in other places. Yet we are eating it every day and feeding it to our children. Yes. So I want to even encourage y'all to start paying attention to what you're eating. Right? Read the labels. If it's a whole bunch of stuff up there that you can't pronounce, probably shouldn't be eating it. Probably shouldn't. And so Dr. William, I want to go into that and we'll kind of talk it through. But what can we do to try to avoid that typical American diet? Like, how do we start making the changes? Let's say somebody out here, right? This is all new information for them, and they're like, I want to do better. Okay. How do we start?
Some people can do a whole 180, right? And drop a habit and change completely. Unfortunately, that's not everybody.
It's not me.
Okay. So, so I'm very big on taking it one step at a time. Don't despise small beginnings. So, one of the things that we've done with the kids is, and this is an example to show you how important it is to switch out. So, with making spaghetti, we would in the tomato sauce we would puree carrots and dump that thing in there.
That's good.
Right? So
Can't even taste it.
I'm just saying, like some people can't uphold, uphold their whole life, but there are things that we could do that puts us in the right direction. But first, of course, there needs to be a decision. You're saying, hey, I value my life. I value what I put in my body. I value the output, right? Being able to be functional, being able to walk around, being able to think clearly. Because I value those things, these are the steps I'm going to take to align with that value, right? And so making the decision and saying, all right, 5 minutes a day of walking. It don't seem like much. And because it doesn't seem like much, we won't do it. 10 minutes walking. It doesn't seem like much, so we won't do it. But dedicating yourself to that decision will then help you make the bigger changes, right? Wait, I guess the fitness guy, the bigger changes that he's looking for you to make, right? But it first starts with making the decision and sticking by it. And so, a 10-minute walk truly in an hour lunch ain't that much, right? Just walking around, which is going to improve mental health, it's going to improve your gut health. But with making that change and being consistent, you're like, all right, now time to move to the next level. So now let's do 30 minutes. All right, now we need to get a trainer because now I want to train for a marathon, right? But start small. It's okay to start small. It's okay to replace your white rice with brown rice, maybe 2 times a week or something, and then being consistent with that and saying, all right, Chipotle, give me that brown rice. Don't give me the white rice that tastes good, that tastes better. And recognizing the hey, there's a taste difference. And let's see, adding broccoli to chicken Alfredo. Just add it in there. It'll help with the taste. It'll help with your fiber, right? Make those small changes because eventually it'll lead to the bigger changes, right? Like even with mental health, you guys aren't like trying to change someone's mind immediately. It's going to take time.
It takes some time.
It's going to take time. And so have grace for yourself, but also be dedicated to that decision. I'm going to do X, Y, Z for this reason, for my health, to live better, to think better, and then, you'll progress. Eventually, you have to progress.
Yes. Those changes that you are desiring to see, they start with you. Dr. Williams just said, make a decision, right? So decide, hey, I want to do this differently. And so I'm encouraging you, make a small step today. Start this weekend and don't let it end here at the retreat, right? You got to take this home with you. Knowledge is power. I sent out an email that included several documentaries. Go get the information that you need to start making the changes. So, if you didn't pick up on anything else, please understand that you have to take care of your body. Your body is a temple. The Bible tells us that. If your body is a temple, why are we putting just anything in it? And this even makes me start thinking about biblical times, right? So the temples that even Jesus went into, there's a level of reverence, there's a level of respect. I'm not going into the temple dressed any kind of way. I'm taking my shoes off when I come in. There are certain things that I don't touch. It's a reverence there for the temple. But we don't have reverence for our temples. If your body is a temple, you're going to have to show some reverence to it. You're going to have to say, despite me, like, oh, I want this fried chicken, right? I know it tastes good. I want the strawberry cake. It's delicious. But you're going to have to realize, but my body, My body doesn't need this. Now, does that mean you have to completely cut it out? Not necessarily. Like Dr. Williams said, over time, the small steps. But y'all, we got to do something different.
Yeah. Yeah.
Our health issues in America are like astronomical. It's ridiculous. And when you start looking at other countries, it's like, wait, they don't have these same issues, or they didn't have them until they started introducing our McDonald's and Burger King.
Hello?
So, yes, food is important. What you put into your body is important. And so, I wanted to make sure that we took time to really hone in on the importance of taking care of your body. So, we're going to open this up. If anybody has questions, we can answer them. We want to have y'all like on a road to make some changes. Yes, go ahead.
Okay, so I think my biggest struggle is I was diagnosed with IBS, which is irritable bowel syndrome. I also work in the medical field, so I know a lot about what you're saying. I struggle with the fact that, so even when I find myself working out, I know my doctor always say that I should put more fiber in my body, but I always tell them that I feel like my body is the opposite because the more fiber I get, the more it irritates my stomach. And I don't know if that's because of the IBS. So I try to figure out how to get around it and just drink water, water, water. But it ain't helping me. So is there a special fiber that you recommend to use?
Now, are we talking about supplemental fiber, or are you talking about you're increasing the fiber in foods, like you're eating more?
There you go.
I didn't
I see by your face.
Okay.
It's the
I do
supplement.
not like the green stuff.
there you go.
Tell the truth, right?
Go ahead. Tell the truth, shame the devil.
Okay? Because of that though, because if I eat a lot of spinach, I just always feel like I'm not drinking enough water. And then if I do try to add those green things, and when I do drink the water, then I feel like my body is retaining it, so my legs and my ankles are swollen, then I have to deal with that battle. So I haven't really figured out where to find the balance.
The balance. So that's like the first thing is that as much supplements are great, as much as you can, or supplements are great, but realize those supplements come from the things that's in the foods. So you might as well eat the food. Eat the food instead of adding the supplement if you can. So it sounds like it's irritating your gut. So I would recommend stay away from it or decrease how much you're taking in. I will say there are some food fibers that don't do well in certain people, which that's fine. But I think that'll be important to have a conversation and to also take a food diary. Anyone have done a food diary? Yes, right? So some of us who have belly pain and nausea and all kinds of stuff, bloating, migraines, yep. If you take a food diary, you're listing out everything that you eat. And then you're looking out for triggers, right? And not just what you're eating, but how much you're eating is important too. And then separately, for anyone who doesn't like greens, you can add it to smoothies. Yes, it has a little grainy taste. I got you. It has a little grainy taste, but it's better than not consuming it at all. And so again, like finding ways to puree that bad boy and add it in something else to hide the taste, kind of trick yourself to eating it. But I would go back to like doing a food diary and seeing what specific types of fiber is it in the greens, is it in the fruit that you see, or the whole grains if you see that there's an issue.
That's good.
Thank you.
Thank you for asking. Yes, go ahead.
So I'm a mental health therapist, and so I had a lot of brain fog. And I work a lot. And I'm like, I kept repeating myself like I had Alzheimer's. I kept saying the same thing over, and I was like, what's going on? And so recently I just lost 26 pounds because I'm going to have surgery, but that's not the reason why I went into this. I really went into this because I had brain fog. And I started to eat raw. And so for the first 12 days of September 15th to the 27th, the 10th to the 22nd. No, When did I go?
August.
September 5th,
August.
something like that.
Okay.
I ate for 10 to 12 days and I had raw cabbage, raw carrots, green apples, and watermelon.
Mm.
I instantly cleared up. Like 3 days in, I was sleeping later than I normally sleep. My niece was like, "Hey, you not up?" I'm like, "Girl, this is working." And I've always, my doctor always said, if you walk 30 minutes, you'll save a year to your life. So I always walk 30 minutes, right? And I want to say that I think that this week is the week that I started eating fish. Organic fish. It has to be baked, no, not a whole lot of seasoning. I can't put a whole lot of seasoning on food. And I think that salt, I get very inflamed. And so I realized that I did the food that like, if I don't eat salt, I don't feel bloated. But like the other day, I wanted something sweet to eat, so I had some apples and cinnamon and a little honey, which was good. But I also needed to go to the bathroom after I had the apples, which I was like, oh, this is good fiber, you know?
Yeah.
I can always
Yeah.
add this into a salad or something like this to eat. I love green smoothies. I got a whole nice juicer. But I say that to say that when you really think about it, because how can I help somebody else heal if I'm not in my right
There
frame
you
of
go.
mind, right?
Don't talk about
So
me, please.
I also eat between a certain period. I eat between 11 and 6, right? Intermittent fasting, and I don't drink a lot of that coffee creamers anymore. It's really either like fat free or if I do, it's a little bit like it's oat. I can't take regular milk anyway, so I drink oat milk or almond milk. But I have to honestly say, you're looking at someone who used to be 300 and something pounds, and I'm down to 220.
Yeah, that's good. Yeah. So I'm glad she pointed a lot of that out. One, we got a whole testimony. We like having testimonies in the room, right? Like people that are actually here that we're like, wait, things can happen and change. But also just pointing out the our body is a temple and does God want to reside in it? Based on what you're putting in your body. Is Holy Spirit like you know how like okay so I gotta demonstrate because I remember being like this with some houses like when I had to go in home to see clients they're like have a seat and I'm like oh I'm gonna sit on the corner of the chair because it's not you're not comfortable right is Holy Spirit looking at your body and like I'm gonna sit on the side. Or is Holy Spirit like, oh yeah, okay. She taking care of her temple. I can relax. You don't want, yeah, if you don't want to be in something that's unclean, you want to make sure that your temple is clean. And we can do that with food. That's yeah.
Oh yeah, the phrase is food is medicine. Either right, like, and food can be your poison, depending on what kind of foods that you have.
Choose your
Um,
choice. Free
one,
will.
correct. So I had one patient. She's 20 something, type 2 diabetes, really bad. Like sugars were in the 300s. And when she went on this weight loss journey, and I helped her, and when she like lost a lot of weight, she was like, "Wait, I can think better. I don't feel fatigued." But before, to her, that was normal. So I can't imagine if we all like did something radical,
Yes.
right, and started taking care of our temples, what big difference we would see and feel compared to what was normal before. So just think about that, like based on your testimonies, like when and my member, she was like, "Yeah, I didn't know I was so tired. I didn't know that there was something over me that I couldn't be my best self, right?"
Yeah.
And so imagine how we are now. We're like, "Oh, this is normal. I'm busy. I'm doing all the things." But imagine if we were to exercise. Imagine if we were to put spinach in our meatballs.
Yep. And whole foods. If we eat what God created, y'all, and watch those documentaries that I emailed out. If y'all need me to send them again, I will. Because if you start getting the knowledge, then you will start paying attention and you will see your behaviors in that change. Because the middle of the grocery store, that's what you don't want. It's only the things on the outside, right? Fruits, veggies. And it actually is probably not even really the outside. It's like a corner.
Right. That's true. It is a corner.
It's a little corner Yeah. Oh my goodness. If we get into the disparities, we'll I got a bone to pick with. Oh my goodness. So yeah, there are definitely food deserts where people don't even have access to grocery stores to get fresh produce. And so if I want us to even if we have never heard of a food desert or never lived in a food desert, recognize it's a real thing and be grateful that that's not. I got an option. I can go to like 4 grocery stores and pick. I can go intentionally find a herb shop. I have access. Not everyone has access, and that's the hard part. I know you had your hand up, so we're gonna go here and then here.
It just made me think about because like when we fast, like when we intentionally fast, right? It's really our body. When we think of, we know the spiritual effects, but the natural effects is actually resetting our body back. It's resetting our mind back. So that's why it's not. It's important to not just jump right in to the foods that you was eating before you started fasting because you can get sick. But it just makes me think of when you're fasting, you hear God so clear.
Yes.
You have so much clarity. But just imagine if we lived a lifestyle of eating light. You know what I'm saying? Because I noticed one thing when the Lord told me, He said, eat lighter. So I don't really eat red meat like that. Of course, I always ate my fruits and vegetables and things like that, and your whole grains and different things like that. So whenever I would eat something that wasn't right, my body instantly, it instantly has a reaction, and I really get sick. And people will look at me like I'm crazy, and I'm like, no, my body is in shock because I don't eat processed food. I don't eat, and it's been like this for almost like a decade. So I was like, I don't eat this stuff. So my kids can't even eat stuff like this because they get sick. It causes so much. It produces so much mucus. It produces that brain fog. It produces like all these different kind of things. And I remember telling my sister, I said, my nephew has severe ADHD. And I noticed the things that they eat, and a lot of things, unfortunately, they have to go to food banks and stuff.
Yes, sir.
They have to go to, they don't get enough food stamps. And personally, she just doesn't know how to actually grocery shop.
Yeah,
So I told her, I said, I have to teach you how to shop because all of you guys are affected in different ways in different areas. And I said, I'm telling you, his ADHD is based off of the food that you're feeding.
Oh, that's good.
And I was like,
I
because you notice, because I think she took about like maybe 2 weeks or so of just feeding just like regular food, like the food that the Lord said, and she noticed she didn't have to give him medicine, his behavior changed and stuff like that. But the moment she ran out and she had no choice but to give it, then all of a sudden everything started reversing. And so it just made me think of, we have to live a lifestyle of eating lighter so we can hear God well, but also when we're eating these good foods and stuff, these things that are coming into the world, these things, these different diseases and different things like that, our body is already prepared for it because we have those natural nutrients that because we're eating properly, so we can like naturally combat against the different things that's coming. Whereas if us, as we know it's no secret, America's food is horrible. So if we eat American food and we eat this processed food and stuff, so then when these different diseases and sicknesses and things like that come, our body was literally meant to just destroy us anyways.
Yes.
Because of the stuff that we're bringing in, and then whatever else comes in, what I'm saying, it's just gonna take us out. So I do thank you, because we do need to understand the importance of your gut health, because sugars break down your mind. That red dye was just mess everything up. You know what I'm saying? So I know we all grew up on that red Kool-Aid, but it ain't good.
And the red dye, I'm glad you brought that up because the red, when I have my clients come in during the assessment, they sometimes it's like a weird look when they tell me about everything that's going on. I'm like, okay, well, how's your diet? What are you eating? Like what does that have to do with my mental health? A whole lot, because I'm going to use a holistic approach in how I'm helping you. It's mind, body, and spirit. They're all connected. We can't leave the body out. So what are you putting into your body? And with the children, that red dye, y'all, is so highly connected to that ADHD.
the talking.
Yeah, yep, the hot chips that all the kids want. Yeah, they are banned in my house. Like, no, we're not eating those. Yeah, but everything. That's why I'm saying, start reading your food labels. If this is all new to you, start looking at those food labels. When you start reading what you're putting into your body, what is this? And Google it. Y'all, some of the stuff that's in these foods, when you Google it and find out what it is, you are going to be appalled.
Throw everything away.
Like a little sawdust in here. Oh wait, a little sawdust in the Parmesan cheese. One of my mentors, a person that really pushed me into the holistic approach I use, is Dr. Bobby Price, and he's based out of Atlanta. And when I started working with him, I completely transitioned into vegan, and I did vegan for about a year and a half. Y'all, that was the best I ever felt. I need to go back to it if I'm being honest. Yeah, that was the best I felt. My A1C was normal. That was the first time I was able to get it to normal. Like, yeah, it's detoxing. There are cleanses. There are things that you can do, and some of this is out here, right? We got Lance's table out here, sea moss, detox teas. We got Tanya's table with, and these are things that I use. So all of the vendors that you see, I'm connected to, right? So the things that you see for your body, these are things that I actually use for mine. Make some changes. Make some changes. Okay, last question.
So, oh my gosh, mine is kind of like a combination of both a question and a statement. First, I didn't even want to come in this class. I didn't want to come here.
Thank you for your honesty.
You know that I'm just gonna. I don't know any other way. But I didn't even want to come here because I feel like y'all are just all way up in my business. You know. But so coming. Oh God, you gonna put the camera on me too? Jesus Christ, give me a spur. Anyway, oh my gosh. So one, I'm gonna say the definitely the journal. Man, you guys are great. Love your comments. And thank you too, because it is definitely, I'm all for knowledge is power. Like, even if I'm not actively in whatever the topic is, I still appreciate the knowledge. So thank you for that. Definitely want to push the food diary for a person who, I'm going to say, used to suffer from migraines. They're sporadic, but I've been praying with those because the devil getting on my nerves with the migraines and the meds. But definitely a doctor presented that and said through the food diary. And of course, when we go to medical professionals, you're apprehensive with the stuff because it don't make sense to you. And so initially when he said it, I'm like, come on, I don't have time to like watching and reading labels and all of that. But I found that once you're aware of what your triggers are, and that's really broad, it's not just for migraines, it's like what you said, whatever the ailment is, once you can pinpoint exactly what the thing is, then you can stop doing that thing and you'll find that you will feel better instantly. The other point I wanted to make is, I don't know if you guys touched on it because I was a little bit late and I apologize for that, but you know, there's always a talk of food and health. I'm glad y'all mentioned the deserts, but you know, I used to say that my income was fixed, but it's not. But I am retired, disabled, and I'm raising a 12-year-old. Not to put all that out there, but I'm sure y'all get the meaning of what I'm getting ready to say. But it's not always conducive to eat healthy. Everyone sits on a panel and advocates, eat this, eat that. But do you know what the price of grapes costs? Or bananas? When I go into the market now, I don't really like Walmart. I prefer Publix. And so I will go there, and I know how to watch for a sale. And sometimes, look, I'm like, all right, God, I need some grapes. We haven't had oranges in a long time. And sometimes he will literally work that thing out. And when I'm on a spiritual gym, I tell them I pray for everything. Toothpaste, whatever it is I need, I'm like, all right, God, what am I getting? What's better? I'm telling you, I better. When he say pray for everything, you're getting a habit of praying for everything, especially when your budget gets a little bit restrictive. So I find myself, where do I go? How can I get this for my son? And so when I can't buy in bulk anymore, I literally started getting 4 bananas, 4 pears. So like you said, trying to be intentional about incorporating it in the diet so we get somewhat of a balance. What happened to, like she and I on sidebar were talking about balance. I grew up in the, 5 food groups.
And
$2 for one banana.
and
Now
I'm
what do I do?
it's a whole blessing that you can drive to Publix because everybody does not have that access. Everybody doesn't have transportation, don't have the extra gas to drive further out. You have any suggestions there? What do you do?
Sure. So, if we're coming from a financial, economic standpoint who are not believers, I'd be like, man, you gotta grind, you gotta find another way to pay. However, we come from a different level.
Come on now.
Sorry. We come. Okay, I got you. We come from a different level, right? We're coming from a spiritual level. Because what did the Lord say? Do not worry about your life. Don't you know that I know that you need these things? He said, don't worry about food. Don't worry about drink. Don't worry about those things. Now, I'm not trying to over spiritualize it and say, well, pray about it. And no. But however, and I have my own testimony. If you tell the Lord, I want to eat healthy. I want to provide for these kids so that they have enough food. You need to make this happen because I can't make it happen by myself. And you said,
yeah.
So sometimes it does take faith. Sometimes it does take, all right, Lord, I'm saying no to this, right? Because I'm saying like, this is not worth ruining my health. I'm saying no to this, and I'm gonna go get this. You're gonna have to make it work out. That's one. Another way, farmers markets. So it's gonna take a little, it's gonna take some time. They're not open all the time, maybe on the weekends, but it might be worth it to trek over there, and get all the groceries, for cheap, and then leave, or going to local farmers. But this year, the Lord has taught me that He is the source. Money is not. As much as I want money to be, I'm like, come on, if I can see it, I can spend it. Right? Like, I ain't got time for it. All right, Lord, please let it work. And then swipe. Yeah. However, the Lord is teaching me that He is the source. Yes. I'm not even my own source. My independence, my function, it's like I'm not even my own source. The Lord has to be my source. And just being real and honest, saying, Lord, this is what I need for a healthy life. So you're gonna have to make it work. And taking the faith and saying, all right, Lord, I'm purchasing this. I'm saying that this is not the bad food, or whatever you want to call it. The processed foods is not worth my health. It's not worth. So I'm gonna invest. So I need you to bring it back 10, 20, 100 fold.
And you think God is not gonna help you fix His temple that He gave you?
You might not see it at first, but like if you take that step, he has to show.
Yes, Jehovah Jireh, my provider. He is our provider. I love that you said that. You got to go back to the source. And it's not over spiritualizing. It really is. You walk in faith. And that's what this whole Hill Retreat is about. Walking in faith, knowing and declaring. Repeat that word back to Him. God's promises, the word says His promises are yes and amen. So if He said it, it has to happen.
So try him.
Try. Oh, that's good.
And just try Him. Say, all right, Lord, we getting this organic $12 strawberries.
Exactly.
You ain't got to do all that, but I'm just saying, like, it could be inorganic for $6, but you know what I'm saying. Like, all right, Lord, let's do it. Let's do something different.
Yes. Thank you, Dr. Williams. This was good. Thank you all for participating, for asking questions. Y'all, for real. And that food diary, I wanted to touch on that again. Please, if you start writing down what you eat, that is going to make a huge difference. Because guess what? What I found when I started doing it, and I found an app that helped me to track everything, I'm embarrassed. Like, I don't want to put it in there. When I go back to the doctor and she asks to see my app, I don't want it to be like, oh, I ate 2 quarter pounders. She's going to be like, what? So that accountability.
Mirroring.
Yes, accountability. So even write it down and have a friend that can help you stay accountable. You share those logs with them. You're not going to want to write down that you went to Popeyes. You're not. And so that sometimes will stop, at least for me, it stopped me. I'm like, I'm not going to put it on this.
What I ain't going to do is put myself
right. I'm not going to embarrass myself. So I'm just going to not eat it. But yeah, and counting calories And be careful with that. Like, yeah, if you need to get input from a doctor. But again, I started looking and I'm like, oh, this is 627 calories. I don't want it because that's going to take up my little points for the day. And I'm good. So I'm going to eat something else that's lighter, that doesn't have as many calories. And then I can eat more of it if I need to. So yeah, it's little tips, y'all. Pull from what we talked about today and get started. Literally just get started. And you'll start seeing a difference. Take care of your temple. Thank you, Dr. Williams.